Sometimes one journey can change the way you see the world. That's what happened to me. My name is Sarah, and I want to tell you about a nonprofit organization called Jhpiego that is saving the lives of women and families around the world. When I heard about the work they do, I wanted to see it with my own eyes. And now I want to share it with you. Because until you've seen what they do and the people they help and the lives they save, you can't truly understand what a difference Jhpiego makes. I spent a month in Kenya, where Jhpiego has been operating for more than 30 years. It was incredible, and I felt so welcome. Here, and in over 50 countries worldwide, Jhpiego, an organization affiliated with Johns Hopkins University, is creating low-cost, innovative solutions that prevent needless death and suffering. About 5 hours north of Nairobi, Jhpiego operates several clinics in Nyanza province, near Lake Victoria. That's where I met Dr. Nancy Kadula, a dedicated Kenyan doctor who became my surrogate mom. She introduced me to a group of community health workers, or CHWs. Because rural Kenya has a shortage of doctors and nurses, Jhpiego trains locals to become skilled community health workers. The CHWs are a major focus of Jhpiego's work here. Day in and day out, they educate and care for the sick and the poor, many times traveling to their homes with warmth, compassion, professionalism, and a smile. Visiting the clinics and walking the streets here, I am overcome with a feeling of sadness. At home, I have been so fortunate and have never worried about receiving good health care. But here, it is extremely uncommon for medical centers to have electricity or even running water. They are dark and crowded. At home, a 12-year-old boy is concerned with buying the latest video game, not being diagnosed with HIV. Dr. Nancy took me to the villages near Lake Victoria, where humidity leads to high rates of malaria. And sailors traveling through the region leave a legacy of HIV and abandoned children. As I approached this small, malnourished little boy, Dr. Nancy told me that his father was one of those sailors, and his mother was only 12 years old when he was born. The healthcare facility here treats nearly 60,000 people each year. There is just one ambulance and no doctor. One of the workers here described the difficult conditions they work under and told me the same thing everyone here says. So much of the sickness and suffering is preventable. As if on cue, while we were talking, a pregnant woman stumbled towards the clinic. She's in labor right now?
Yeah, she's in labor.
We learned that she had been in labor for 12 hours and walked 3 miles on a rocky, unpaved road to get help. She was completely alone. When the woman arrived, there was no doctor to treat her, so Dr. Nancy stepped in. She determined that the woman needed to be transferred to a hospital several hours away. She was in an incredible amount of pain. We never found out what happened to the mother or her baby. Here in Kenya, 50% of women give birth alone. And every 90 seconds, a woman dies in childbirth. It is easy to see why Jhpiego is so important here and why they need our help to do more. In addition to rural areas, Jhpiego also operates in Kenya's densely populated urban slums. Like much of the developing world, many people here live on less than $1 a day. And along with poverty and insecurity come high rates of disease and mortality. A toxic mixture of trash, human waste, and discarded food covers the ground. And I'm surprised by the number of kids wobbling through these filthy alleyways alone. The CHW tells me most of them are street children, orphaned by parents who died of AIDS. Kenya has the second highest HIV rate in all of Africa. Jhpiego is trying to combat HIV through testing and education, along with male circumcision and treatment that can prevent mothers from passing the virus to their children. Day after day for a month, I watched Jhpiego workers deliver healthcare under the most trying of circumstances. The last clinic I visited in Kenya was in the worst shape of any I had seen. Peeling paint and rust covered the walls. But Dr. Nancy told me it was one of the clinics she had the most pride in, because the workers here are the best she's seen. Many of these nurses travel miles to work on foot each day. This nurse tells me that 2 patients have named their children after her. The dedication I see in this broken down building makes me think of something I've noticed throughout my entire trip. Despite the lack of electricity, running water, or enough doctors, people here are still full of hope. After everything I witnessed, the sickness, poverty, and despair, you might find it hard to believe that I left Africa with a sense of optimism. But I did. All you need to do is spend a little time with the people of Jhpiego to understand why. Their dedication and compassion is inspirational. They work every day to save lives and educate people so that things will be better for the next generation of mothers and their children. They are successful because they are providing sustainable solutions, many of them simple and inexpensive. When I got home, I thought a lot about that crumbling clinic in Gobai. So my family and I decided to raise the money to help renovate that clinic. The work will begin soon. My trip to Kenya transformed me. It took me out of my comfort zone and exposed me to a part of the world I had only read about. I made this video to share what I experienced in this beautiful and complicated country. So please remember the faces you have seen and the stories you have heard. Jhpiego is making a difference every day, but they can't do it alone. Simply put, Jhpiego needs your help to save lives.
In Africa, most people think of malaria, AIDS, and childbirth as leading causes of death. But there is a silent killer that is plaguing the continent: cervical cancer.
Every 2 minutes, a woman dies of cervical cancer. Nobody notices that these women are dying unnecessarily from a cancer that is preventable.
Mrs. Ajaratu Kinda, a mother of 6 children, didn't know about cervical cancer until it was too late. A simple test that cost less than $5 could have saved this woman's life. This woman was also diagnosed too late. There's little that can be done at this point aside from making her as comfortable as possible.
It's really, really sad to watch these women in pain and really realizing that we could have tested a few years back.
Because Pap tests are essentially unavailable in the developing world, Jhpiego has championed a safe, inexpensive, and effective screening method that uses simple table vinegar.
You can get vinegar in every country, and so that's why it's a low-cost initiative that can save hundreds of women's lives. We call it the single visit approach, where they screen with the vinegar. If they see abnormal cells, then they treat that woman in the same visit.
When programs do not screen and treat in a single visit, half as many women will get the life-saving treatment they need.
Qu'est-ce que vous avez appris aujourd'hui? Même en dehors d'ici, on peut faire des dépistages ailleurs.
Dr. Jean is really, we call him a champion of cervical cancer.
Jhpiego a joué un rôle important dans la prise en charge vraiment de la santé des femmes au Burkina dans le domaine du cancer du côlon.
J'ai 37 ans et 3 enfants.
Ce programme de Jhpiego nous a permis d'avoir une relation avec la communauté. Je m'explique.
C'est la publicité à la télé qui passe, donc c'est par ça. Donc c'est la peur maintenant, je suis allée voir s'il n'y a rien.
Mais ça tourne autour de 7000 femmes qui ont eu à bénéficier voilà, de nos screenings et de prise en charge.
Si tu venais ici, donc il n'y a rien.
Et mon souhait le plus profond, c'est que nous continuions à étendre la formation, l'équipement, la supervision vers les hôpitaux, les formations sanitaires périphériques.
We know that every 2 minutes, a woman dies of cervical cancer. We know that cervical cancer is preventable. But for the lack of a few dollars for a screening test and treatment, women will die due to cervical cancer. When a mother dies, her children are 10 times more likely to die. This is our time. It is our time to use the tools we have to screen and treat women and save women's lives. Please support Jhpiego to prevent and treat cervical cancer.